everyone. Give us another moment or two as the attendees load in. All right, we do appear to be stabilizing. So welcome everyone to our pre-Labor Day weekend. Oops, sorry about that on the schedule. Back to school town hall for grad students and those who teach and serve grad students on campus. We are so pleased to have you here. For those of you who may be new to campus, I'm Jillian Hayes. I'm Dean of Grad Division, and I'm gonna start this town hall off in a moment with letting everyone else on this wonderful panel give us a few minutes of the latest and greatest information we think it's important for you all to know. But most of the reason they are here really is to get to your questions. So we will not spend very much time on introductions, just a few minutes from each of them, and then over to your questions. So in the meantime, if things come up while they're speaking, feel free to put a question into the Q&A box. And we will work on answering those as we go through. I will remind you, often it is the case, if you have a question, so does someone else. So please don't be shy about asking those questions. And as I say, I'm going to defer to all the wonderful experts on this panel for most of the things, but I just want to say to you all that I am feeling more optimistic and hopeful on this particular Friday than I have in the past several. And I'm really looking forward to many of you being back with us on campus and getting to see you and spend time with you. So thank you for being here today. And we look forward to a great fall. With that, I'm going to start off with someone who's basically the man of the hour these days, David Souleles, who is the head of our COVID response effort here at UCI. Not all of your questions or concerns are going to be about COVID today. We know that, but a lot of them might be. So I thought it would help if we'll start with David, and then maybe we can go straight to Dr. Albert Chang, who's our medical director at Student Health, and they can really hit some high points there to start us off. Over to you, David.
Great, thanks. And hi, everybody, for a Friday afternoon. Welcome, and thanks for taking time to be here. So again, my name is David Souleles, and I'm the COVID-19 response team director here at UCI. Really, my role is to assure that the campus is as safe as possible as we all think about returning for in-person learning and research, and as our workforce comes back to work as well. I know you're all excited about getting back. We're excited to have you all coming back, and we've put into place a whole variety of policies and procedures and protective measures to help make the campus as safe as possible. Probably one of the most important ones, and I'll use this as the first commercial break of the day, is our COVID-19 vaccine policy for the University of California, which requires all students, staff, and faculty to either be vaccinated or have an approved exception or deferral from the policy for medical reasons, religious objection, disability, or pregnancy. So the deadline for being in compliance is September 6th. So if you have not taken steps yet to either upload your vaccination records or file for an exception or deferral, this would be the time to do it. Otherwise, you will be seeing the non-compliance letters coming from us on Tuesday, and we'd like to see as few of those going out as possible. But obviously, that's our first line of defense. The more people we have vaccinated on campus, the safer our campus community is going to be moving forward. We have a whole other series of things we're going to be asking our communities to do, from daily symptom checking, asymptomatic testing for those who may be required to do so who are not fully vaccinated, mask wearing indoors, a whole series of things that we want to do to create the campus environment that's as safe as possible. And as we go through the town hall today, we can talk through what some of those are. We also have a very robust program for identifying cases and following up on cases and contacts, again, to help keep the campus safe. So happy to answer any questions related to that may come up today.
Okay, so Jillian, should I just go ahead and jump in? Okay, hello everyone, I'm Albert Chang. I'm the medical director at the UCI Student Health Center, and I wanted to thank you all for your valuable time, and especially to Jillian for inviting us to this opportunity again. And we work with you all kind of on individual levels. I've probably even spoken to some of you or seen you as a provider, but to address you all in this way, especially at this time, I think is really important. I'm here to just remind you all that our Student Health Center, this building behind me, is still open, has always have been open, and will continue to be open for your basic primary care services, specialty supports, and anything else you may need as graduate students here at UC Irvine. Now, I believe most of our graduate students have the UC SHIP plan, the Student Health Insurance Plan. As a reminder, although we can provide care to all students at our campus, if you have Kaiser or a different plan, you may be charged for services here, or you may be reimbursed for services that are provided. But for those of you that have our plan, we are your PCPs. And at this point, we have about a dozen providers working still out of the Student Health Center, providing basic primary care, doing women's health, reproductive health services, in addition to some other specialties such as psychiatry for mental health support, dermatology, nutrition and dietary support, as well as chiropractic. And ENT is coming back. Our ENT doc went away, he'll be back. We have a full service pharmacy on site. We have a service that can deliver medications to your door if needed. So if you're on chronic medication, a wonderful option during this time where being out and about is maybe not that best thing, as well as a full service laboratory and radiology. We have x-ray service as well as now ultrasound on site. So we are still doing all we can to provide service to you. I wanted to also share that we have telehealth. Now, telehealth is a thing that's revolutionized healthcare, especially during this age of COVID and being careful about going out. So if you would prefer a telehealth visit, for sure, let our teams know when you call for that appointment. There are certain visits, of course, that need to be on site, certain types of procedures, or something that requires lab work or x-rays. But if it can be done through telehealth, that's a smart, safe option. And through this past year, we've even worked with our students that have been COVID positive with COVID symptoms to do a telehealth visit first, reviewing symptoms, referring to our site to do a drive-through COVID testing, and then following up on results. So that in a sense protects you as the patient from any additional exposures, and then our staff as well from any additional exposures. There may be times for sure when we want to bring you in to listen to your lungs, to take a look into your throat, but if it can be done through telehealth, right now that may be a safe measure, and that's that safest measure for you all. I think it's important that we continue to do our daily symptom check because there's a variety of different symptoms that might come up. And we have to remember, even though we're all focusing on COVID, there are many other things that can happen to each and every one of us that can be spread to others. So infection control, the basics about washing hands and taking good care of yourself first is that big message. I'll go ahead and stop there, and I'll welcome your questions as they come up.
Thank you so much. And we do already have a lot of great questions coming in. I'll just remind people, queue them up. I'm watching them. Don't worry. Let's get through the intros and then we will move over to those. So we have had some great speakers so far on your physical health. What I can tell you for sure is that mental well-being is just as important for our students as our physical well-being. So I'd like to invite now Dr. Diaz and Dr. Hayashidas to speak about our counseling and wellness services.
Great, thank you. Thank you for having me here today. So the Counseling Center is excited to continue to offer our teletherapy services. We've been offering them for the past 18 months. We are still focusing on what is the safest way to deliver these services. We are also returning to campus, but all our services will remain virtual. However, we recognize that some students may not have a private space to engage in these services. And so we are opening up our doors for students to reserve a private space in the Counseling Center building in case they need to engage in those services privately. And so if there's any questions or you need any guidance around that, please contact our office and we're happy to walk you through that. We also, our crisis and urgent care services have continued to be available virtually over the last 18 months. But we will also have the ability for campus partners or people to walk physically into the building if you are on campus and in distress and need some support. Just be aware that we will set you up for a virtual appointment, and some of our providers will be on site and some of our providers are off site. That also has a little bit to do with just office space as our staff has grown. We appreciate the investment in mental health services, and we have a limited amount of space, so we're trying to make the best we can, but also really focused on the safety, health, and wellness of others. And as we're a healthcare agency, we are required to remain masked and we know that therapy isn't the most conductive or conducive to, masks aren't the most conducive to therapy services. And so we're trying to make the best of that. If you have a need for something different, please reach out to us and we can help facilitate getting you connected to the right resource around mental health services. I know Dr. Hayashida has a whole other set of wellness resources.
I do. Thank you so much, Dr. Diaz. There's a little PowerPoint that accompanies my remarks, and so hopefully that can be loaded. While we do that, I'll just say briefly, my name is Dr. Marcel Hayashida. I'm AVC for Wellness, Health, and Counseling. And you've already heard from two of the offices that report up through me. I don't know if we're going to load the presentation for everyone to see or just have people.
There it is.
Go along.
Like I know it's here somewhere.
Great, 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 great. Okay, so we'll just hit the next slide. So I'm going to go over some of these things really quickly, but of course you are always free to email if you have questions and put some questions in the chat. And when it's no longer my turn to talk, I'll be happy to answer some of your questions. You've already heard from the Counseling Center. That's one of the offices in Wellness, Health, and Counseling Services. Is the primary first stop for on-campus counseling, provides short-term, time-limited mental health services. All kinds of, and I'll talk a little bit more about this in a second, but there are all kinds of online resources as well to help you and the students that you teach transition back into the physical environment. Another office that reports up through me is the Disability Services Center, which helps folks who have disabilities, who need accommodations, whether it's an accommodation for learning difference or ADHD, or if you are hard of hearing or hearing impaired. So there's all kinds of things that if you break your leg at a skiing incident or something and you need someone to drive you around campus for a short period of time while you heal, there's lots of services that that DSC can provide for our population. So please, that should be, you know, in your syllabus, should also be as you were working with students who tell you about various illnesses or disabilities, that please refer them to DSC. Next slide, please. Student Health Center, you've already heard a little bit from our medical director, fully accredited outpatient medical and dental clinic as well. Please take advantage of the dental services. That's something that tends to be underutilized in this population. And you get all kinds of things that we want you to take advantage of. Primary care, physical care, preventative care, and of course, all of you will have been vaccinated or will have asked for an exemption, but that's something that certainly Student Health can provide as well if you are traveling and have not been able to kind of get that second vaccine, which all of you have already had. The care office is a confidential and safe place for victims of sexual assault, sexual harassment, abuse, intimate partner violence. Again, a lot of fantastic programs for people who've been affected by any kind of trauma, and lots of community events as well. So there are events for people who are allies as well, who want to be support people for folks who experienced trauma. Next slide. Campus Recreation, please come and take advantage of this beautiful space. They really are excited about people being able to physically come back and take full use of the facility. But the ARC is the name of the building, but Campus Recreation extends. We have a variety of outdoor activities and events, hikes, and other kinds of things. So please take advantage of that. Center for Student Wellness and Health Promotion, another office that does a lot of preventative care for folks in the community. Information, educational programming from sexual wellness. We have a dietitian on site, all kinds of wellness, meditation services. So please take advantage of that as well. Next slide. Almost done. Some of you are coming to campus with little ones, and so we want to let you know that we have several childcare facilities, and we actually even have some subsidized care too, depending on your income. So please take a look at that. We've got preschool programs and after school programs for school-age children as well. There are employees, students, and community members who take advantage of those services. Office of Campus Social Work. Used to be Office of the Campus Social Worker when we had one social worker. We've since expanded this over the course of the last few years. And so there are a variety of folks who provide social work services. That's if you are food insecure or housing insecure, or know of your undergraduate students who are food or housing insecure. People who maybe have other kinds of life stressors, who have deaths in families, who need to go home for other kinds of things. Any kind of psychosocial stressor doesn't need therapy, right? Or a peer program. If you need someone to just kind of walk you through getting you to resources, plugging you into childcare or other kinds of community resources, social work is fantastic. We have one or two more slides. Next slide, please. I want to talk briefly about system-wide wellness efforts, and so that you know that we're not just this island doing our wellness services, that we're plugged into a variety of services across the system. There's something called the Healthy Campus Network, and so we borrow from each other interesting programs. There's something called the Okanagan Charter, which perhaps you saw the press release the university has just signed on, that we are committed to being a health promoting campus. So not just promoting physical health or clinical services, but really making UCI a place that's kind of building wellness, baking wellness into the system. We share data with UC counterparts to benchmark and improve services. And it looks like pretty soon, UC will announce some funding for equity and mental health. So please stay tuned, but know that we are working really hard and we'll be given some resources by UC OP, system-wide resources, to add and to take a look at communities that maybe need additional boost and additional post-pandemic, if there ever is going to be a post-pandemic, services to improve student mental health. I think that's it. Oh, and just some online mental health resources that are through the counseling center, virtual resources to help you kind of get ready to return, lots of TAO, sort of online resources to kind of walk you through what is anxiety and what is depression. So please take advantage of some of those resources as well. My time is up. Thank you very much. Happy to have you here. Welcome and congratulations.
Thank you so much. And I know that was a whirlwind for some of you. So there is a link to the presentation in the chat. And I think for those of you watching this later on delay, we can also put a link into the comments section of the video. So you should be able to get the presentation. And I'll give one more quick shout out, which is there is now a social worker entirely dedicated to graduate student issues. And we are so excited and thankful for that investment there. So we've got a decent number of questions in the chat and beforehand, thanks to those of you who sent them in, asking what the heck classroom life is going to be like when we go back. I know that's a source of a lot of concern for folks, and thankfully for you, we have the experts here. So over to Michael Denon, our Vice Provost for Teaching and Learning.
Hi, Jillian, thank you. And I think the way I like to describe classroom life at the moment is we are moving back to a normal world in some ways and a very different chaotic world in others. So I am a big believer that for the next 3 to 5 years, even if COVID were not around, teaching would be chaotic because we've learned all this technology stuff. We've learned all these other things. So there's an element of chaos that just comes from what we learned. The other thing, and David will correct me if I'm wrong, we are now having to make a very hard mental shift for most people, which is the public health situation with COVID is very different when you have vaccines and with everything we've learned in the last 18 months than it was last year. And so a lot of the things that we were told we needed to do last year, we feel like it was about protecting us as individuals when it was actually about public health. And that's a hard shift to make. And so when you come to the classroom, you know, we're still getting questions about the physical distancing in the classroom. Well, that's not actually relevant at the moment from a public health point of view. If it becomes relevant again, we will do it again. If it becomes relevant to be fully online, we will do that. Right now, what is relevant is wearing a mask, and the rest is kind of, you know, being normal, which is why Francis and Marcel are on the call, because that can be very stressful for some people and it can be anxious, you know, inducing. So we understand that this transition may not be easy for everyone, this switch between what's public health relevant and what's individual person relevant. And that's why we still have 3 weeks till we start instruction. We're glad for that. We see that Berkeley's doing well. We see that the law school is doing well. reports from my colleagues, there's mental health because they're back in person in the law school for students is way up. So I really hope people can use some of the question and answers today to realize why we are concerned about certain things and not others in the classroom has to do with the public health situation. All of the individual stuff, questions about disruptions, individual illness, what to do if you're sick. I hope you also saw UCI has huge machinery, lots of units. We've been dealing with students who are sick since the campus existed. We will be dealing with students who are sick long after COVID is relevant. We will be doing, luckily at UCI, with very few student disruptions in classes, but we know how to deal with it. We've had it before. So even though these seem maybe a little more intense now because of what we just went through with COVID, they're all stuff we have the offices, the staff, the people, the procedures, the policies to handle. And I think that's the hard mental shift. We're seeing faculty, grad students who are TAs, grad students who are students in class, and undergrads who are in the class kind of wrap their heads around. So we understand the challenges, we understand the stress, and that's why we're going to have this town hall, other town halls. That's why we're trying to really ramp up communication with 3 weeks to go as people think about it. And everybody should know we're working very, very hard. If the pandemic changes, we will shift. And I'll just close with the number one question I seem to get is, if the pandemic gets way worse again, what are we going to do? How will we? I'm like, well, we already did that. We've done the worst of the pandemic once. I really, really hope we don't have to do the worst of the pandemic again. But if we do, we know what to do. We've done it. And so that's kind of where we are with teaching. I don't know if that makes people more nervous, less nervous, or exactly where they are. But if there is still stress and anxiety, we got a great team to help with that and help us get through it. So that's where we are in teaching and learning, Jillian.
Thank you, Michael. We do have some specific questions. I just want to acknowledge that they're in there in the chat that we will get to, about asking for accommodations, about mask and vaccine compliance and so on, that sort of wrap around some of the things you've already heard. We will get to those specific questions. Never fear. We have a few more intros that I do want to get through. Many of our graduate students are not just our students, but are also our employees. And so many of you interface with Sonia Lepe, who is in graduate division, who helps you with that part of your world. So just wanted her to give a few updates because employment is still a little bit different in the fall than it has been, pre-COVID. So over to you, Sonia.
Thank you, Jillian. Hi, everyone. We're so excited to see you this fall quarter as we transition back to campus. As Jillian mentioned, I do currently oversee graduate student employment, remissions, and fellowships for graduate division. Our graduate student support office provides graduate student employment guidance to departments and students regarding academic policy compliance, collective bargaining agreements, fee remissions, and UC Path. Each fall quarter, one of the most popular questions our team receives from both departments and students is regarding graduate aid. Graduate aid is provided as a benefit of eligible employment for certain titles. For example, full fee tuition remission covers 100% of fees and tuition for all GSR and GSAR, which are the graduate student researcher and graduate student researcher assistant appointments of 25% or more for the entire quarter. If applicable, this also includes the NRST remission and the document fee, which I've actually listed here on the slideshow, both amounts. There is also the partial fee tuition remission, which is available to all academic student employees. This includes all students in the teaching assistant, teaching associate, readers, and tutors titles who are employed for at least 25% or more, or work at least 110 hours during the quarter. This support covers the student service fee, tuition, G-SHIP premium, which is the health insurance premium, the $100 towards campus fees. Please note, the partial fee tuition remission does not include the non-resident supplemental tuition or the full amount of campus-based fees. On that note, the campus fee payment deadline for fall quarter is Wednesday, September 15th. Classes are dropped and a late service charge of $50 is assessed if tuitions and fees are not received before that fee 5 p.m. fee payment deadline. So if you're still showing a balance on your account at this time, please don't hesitate to contact us. If you have already been hired in UC Path as a 25% GSR or an academic student employee, you can contact us through the Graduate Division Employee Experience Center ticketing system, which I provided a link here in the slideshow. Lastly, due to COVID, a temporary extension to the max number of terms from 18 to 21 quarters, a grad student can serve as a teaching assistant or associate has been approved for fall 2020 through spring 2022. While UCI is planning for a full return this fall quarter, departments have remote TA options, by exception only, of course, and they will review these requests to accommodate remote assignments. For more details, please make sure that you reach out to your home or hiring departments. Thank you.
Thank you so much, Sonia. And I'm glad that you ended on that note about exceptions. So the sort of biggest, most key reason that we need to do an exception for your employment as well as for your instruction has to do with our international students. So I'm going to pass it over to Archana Sheth, who can comment a little bit on how things are going with getting visas and where we're at with that.
Hi, everyone. Good afternoon or good evening, wherever you may be right now. Maybe you're not in Irvine yet. My name is Archana Sheth. I'm the Associate Director of the International Center. So I'm just here to let you know that our office primarily focuses on providing services to F and J students. We know that it's been a very long 18 months learning remotely for our students who started programs remotely. You may be coming to campus for the first time. So we know there's a lot of transition happening. Our office will be open this fall, but we are keeping most of our services in a virtual format. So there will still be appointments available with advisors through Zoom. We have some courses that will be both in person or virtual. So there's multiple formats of certain programs going on. So I just want you to know that the services are still available. Staff is available. If you need to reach us, we have a chat function on our website. So that's a great way to get in touch with staff quickly. We're going to continue offering drop-in advising sessions, which are a little less formal, but if you have some general questions, those will take place every Tuesday, Thursday. And for those of you who are getting ready to travel or may see some sort of delays in your arrival to campus, please feel free to reach out to our office. We do have some resources. If we do not have the right resources, we'll definitely redirect you to the resource that may be of assistance to help you get here or plan for a late arrival. That may include working with your graduate departments as well, but we're happy to connect with you. So please keep that in mind. We know that there's definitely some flight delays happening, and for students in certain countries, there may be visa delays that are still underway as well. So please contact the International Center. Let us know what your particular situation is so we can guide you to the right resources.
Thank you so much for that. And speaking of arriving to campus, many of our wonderful international students, as well as our ones from here in the US, will be arriving to campus soon if you haven't already. We've got 2 reps from our grad and family housing who can answer questions for you, but also give you a quick update on how move-in is going. I know that's always a stressful time, so thank you, ladies, for giving up an hour of your day at such a busy time of year. Over to you, Gretchen and Jennifer.
Good morning or good afternoon, I guess. Thank you for having us, or good morning, depending on where you are. I serve as the Senior Director in Graduate Family Housing, and Gretchen is our analyst that manages our guarantee. And our department has been here and operating and fully serving you throughout the pandemic, and we're happy to be here. What we want to remind everyone about is we are a 24/7 operation. So if you get here and have an emergency, whether it be a health emergency, some sort of emergency from maintenance to anything, we have staff that are on site and available to help you all of that time, during that time. To that end, one of the things we wanted to remind people about is we serve not just students, but also dependents and your families that live with you. And during this COVID time. If someone in your household tests positive for COVID, not through the student health, we ask that you make sure you contact tracing and let them know so that we can make sure to provide services for you, connect you with kind of what you need to do from an isolation or quarantine and manage the public health situation in our communities. We are happy to report that 95% of our graduate and family housing residents are in compliance with the vaccination policy at this time. So thank you to everyone. And just a reminder that after September 6th, not just our current residents, but if you're on the wait list hoping to get housing, you will not get a housing offer if you are not in compliance with the vaccination policy. So it's important that you follow the steps to be in compliance. Additionally, if you've already moved in with us, we are going to be doing some baseline testing starting next week. And so we need all of our residents to go to the student health portal to sign up for that testing. If you're moving in after next week, you need to test within 48 hours of arrival. But if you already live with us, you need to test. And if you're away on vacation, maybe right before the academic year starts or visiting family, that's okay. There's an absence form for you to fill out just to let us know that. And then you'll need to test upon coming back to campus within 48 hours. And just a couple things, we're gearing up and excited to kind of resume some different operations in the fall. We're looking at some welcoming events for our communities and creating belonging for our residents that live with us. We've heard from residents that there's excitement about some in-person things and some anxiety in that process. We will be offering kind of hybrid services and programs, both in person and virtual, to meet that belonging need. So thank you.
Thank you so much, Jennifer. And I just want to give you credit. You've put on some great events, both outdoors and online throughout the last year and a half. I've heard from a lot of our students how much they appreciate that.
Jennifer, can I just clarify one piece related to move-in in particular? So for our students who are actually moving in during move-in week, we'll have them test during move-in. So it won't be the 48 hours. So they'll actually test prior to getting their keys.
Fantastic, thank you. And I'm going to ask you two to tag team again on one of our first questions here, which is about what happens if someone tests positive who's living in on-campus housing. I know we've been doing this for a while, but not everyone who's on this call has been here with us doing it. So if you two could kind of comment on what happens next if that happens.
Sure, I can start. So typically, test results get reported and information gets reported in a number of ways, but one of the ways that that information gets reported is through our daily symptom checker. So if you're an individual who has symptoms, you'll be doing a daily symptom checker indicating that. You would get referred to student health services for testing for those symptoms. And if positive, we would then begin the follow-up process. But we also know that people sometimes test outside, test in other areas, and they may become positive. And we would want you to report that information to us as well. And a few things happen once you test positive. We become notified in contact tracing and vaccine navigation services, and you'll receive a call from one of our contact tracers who will interview you. We want to make sure you're okay. We want to make sure you have the resources you need. If you're living in on-campus housing, we need to work with campus housing to move you to isolation space so you can safely isolate. And so your housemates and roommates are able to be safely protected as well, and then support you through that process. We will also link you as needed up with student health services for any medical needs associated with your COVID-19 infection. We work very closely with campus social work too for any needs that might come up as part of that process. And I don't know, Jennifer or Dr. Chang, if you want to add anything else to that process.
Yeah, I can just add on a clinical level, if you're experiencing additional symptoms, we have a full team available, myself included, to make sure that you do get that right level of care. Even if you do have a different insurance plan, we will definitely provide that support. It gets tricky when we are not open over weekends, but we make sure that emergency services, urgent cares in the area are available also. So clinical support is our top priority.
And I would just add, from a support level, if you do test positive and need to go into isolation, we do have spaces on campus designated as isolation spaces if it's determined that clinically that's what's best. We have staff in housing that will work with you to make sure that if you don't have transportation, to assist with transportation there, that will other services that you may need, whether that be making sure that you have meals while you're in isolation and that you have what you need while you're in isolation. So we'll connect, and you will have some a support staff from housing as well as other parts of campus helping you.
And we provide that support for students who are COVID positive, so who need to isolate. But then there may be close contacts, people who came in close contact who may, based on interview, if we determine necessary, have to actually quarantine for 10 days from the date of their exposure, and housing will help support that effort as well. And I should also say, for those of you who might not be living on campus, but are going to be living in the surrounding community, and you find yourself COVID positive or a close contact to a case, and you've got 6 people in your apartment and you're wondering what to do and how you can safely isolate or quarantine, we will work with you and Campus Social Work and Housing to see if we can arrange for campus-based isolation and quarantine support as well. I do want to say just one more thing, Jillian, if I can, about this, because I think it's an important distinction this year and different than things have been in the past. And this gets back to what Michael was saying about vaccine levels. So we're excited that we're hopefully going to have a very high level of vaccination amongst our students, staff, and faculty. 90% or higher is what we're going for fully vaccinated here by the time we start classes. The really piece of good news about that is, per current public health guidelines and orders, if you are fully vaccinated and a close contact to a case, and you have no symptoms, you do not need to quarantine. And that is new since we've had the vaccine. Before the vaccine, anybody who was a close contact had to quarantine. So it provides, because of how effective the vaccines are, it provides a level of protection and a level of comfort for us to not need to quarantine you as part of that close contact. So we're excited about that this year, and hopefully it'll allow us all to keep kind of moving forward in our learning and research efforts.
Thank you so much for that. We've got a few questions that I'll sort of collapse into one, which I'm going to call compliance questions. So if you could run down maybe quickly, and I think, David, this probably starts with you again, but goes to some other folks as well. Sort of what happens for people who are not in compliance with our vaccine policy, or people who are not in compliance with our masking policy. Michael, you may want to speak to what's going on in the classroom if a student refuses to mask, et cetera. We're seeing a lot of questions that sort of fall into that. What if we think someone has fraudulently given us a fake vaccine card, et cetera? So if we could just quickly speak about compliance broadly.
I think I can start at the big level. So we are requesting, obviously, vaccine verification. So we actually need to see vaccine records, and students are uploading those records into the student health portal. We have a team of staff that are reviewing those records to make sure they appear to be accurate and correct and consistent, and then verifying those. We have the ability to check student uploaded records against the vaccine registry here in California. So we can do spot checks if we need to determine if we think anything might be going on as part of that. So there's a whole kind of compliance process built into the review process built in as well. In terms of just compliance with any of our campus directives and policies, right? So as a student, you're agreeing to abide by the policies and directives of the University of California, Irvine, when you become a student here. And we hope that what we've put in place is really put in place as a way to keep us all safe and healthy collectively as our community. But if we find, hopefully, those rare occasions of a student who may not be in compliance and not be willing to get into compliance, that would become a student conduct issue and referred to student conduct for follow-up. So I see some questions in here about masking and how do we assure people are masking correctly. Well, this is where we're going to need all of your help to make sure you're really doing it right and checking out the information and the resources that we have available on our website about masking and how to mask properly. And it's never a bad idea to be a good friend and encourage people, to do the right thing in a positive and friendly way. I think our faculty will be asking you to mask up if you're not masked when you walk into the room. And I think that's a reasonable expectation. And I think it's also reasonable to expect that if you're not masked when you walk into the room, the faculty will ask you not to stay in class. So unless you have an appropriate exemption to masking under a disability deferral for masking. So, so we are, our goal is everybody, we start from the premise of everybody wanting to do the right thing to keep our campus healthy, and then we will take steps if we need to ensure compliance as we move forward.
Yeah, and David, I'll just add real quickly in the classroom, we are providing faculty with, masks that they can give out and offer to a student so that it's not just simply you have to leave if you forgot your mask. We also, want to remind people, as you said, these are student conduct issues, and we have a pretty good history at UCI of not having student conduct issues in the classroom. And so I think students and faculty, it's a little out of their comfort zone of what to do with this. But I think based on everything we've seen at Berkeley, which is very similar, I think, David, you're right. We're optimistic. We're not going to have a lot of issues with this. I mean, people might forget, you're walking outside without your mask, you forget you've walked inside. And so the friendly, positive reminders may need to happen. But I think all in all, we'll be good. But worst case scenario, this is what student conduct partly exists for. And so that's how we'll be sort of using it and navigating this situation.
And I will say, even me as the COVID guy for campus, every now and then, I've been working on site for a year, every now and then I walk out of my office and I forget my mask, and my staff, if I show up into the other room, they're like, "Where's your mask?" And it's like, okay, turn around, go back, get my mask. So a couple other questions I can maybe get real quickly here related to testing and if folks will be notified in the classroom if there's a case. So we have testing sites on campus, one in the student center, and we'll have additional sites on campus that will be available and used for anybody who's required to test as part of being on campus. And we'll be having testing for anybody who's not fully vaccinated, and there'll be some testing that will be done for fully vaccinated persons as well. And we'll be putting out that information here in the next week or so. But a new feature we've added this year is the ability for any student, staff, or faculty member at any time, if they want to get an asymptomatic test, for whatever reason, to be able to drop in and do that at our testing sites here on campus. So that resource will be available. Anytime you are symptomatic, you're feeling symptoms, we want you to stay home. We want you to answer that on the symptom checker, and then the good healthcare providers at Student Health Services will evaluate you and get you linked in for symptomatic testing. We want to make sure you're not putting people at risk in the event you do become positive. And in terms of classroom notifications, we are actually in the process of implementing a notification, an exposure notification process for classes. So when there is a case in a classroom, we will make notification. The good news is, with a very highly vaccinated campus, again, close contacts who are not experiencing any symptoms would not need to quarantine. So really it's an exposure notification just to let you know what's happened in the classroom. So we are implementing that. There's also a daily notification email that goes out, a daily update, which will tell you every basically building on campus where there's been a case, and that's reported out daily as well. So there's reasonably good information out there about what's going on campus. We also post case reports, case numbers on our public facing webpage as well. So you'll be able to gauge what's going on the campus compared to the community.
One quick follow-up contact tracing question for you, David, and then I think we've got Albert's going to comment as well. Do you want them to notify if they are in a fully online program and not living or coming to campus ever? Do you still want to be notified of a positive?
So typically in that case, they would be answering no on the daily symptom checker because they're remote, so they're not coming to campus. So we wouldn't necessarily need to follow up with them. That said, if they need help or support, they should always reach out to us and we can help them out and get them connected. And the other thing is, and I will say this, we have seen this a lot over the last year where we've had cases where people have said, yes, I'm remote. But then when we've talked to them, they've said, but I did come on campus for 2 hours on Tuesday, right? And so, we do, if somebody really is remote, we want to make sure that means they actually haven't set foot on campus, because our goal from a public health protection perspective is making sure we're keeping the campus safe and healthy. But we always want to support our students wherever they're at in the world with any COVID-related issues. And so we're happy to talk to folks if they need help.
Yeah, and my follow-up was exactly to that point, Jillian. So as a clinician, if we are definitely your PCPs, even if you're remote, it's probably good for us to have a record of that in your health record. So whatever that copy of your positive test is, and if you do need a letter for support for whatever clearance to go back to work or whatever that is, we can help with that. If you're having symptoms though, I would recommend seeing a local provider. So if you're out of the city or out of the state or out of the country, make sure you should all know where your closest PCP is, and they should be able to provide you with that direct support. And they will probably be able to provide you with a clearance letter as well. But if you have our plan, I'd appreciate to know that as a part of your history, because as you all may recall, so our medical record in student health is your medical history. And when you graduate and go forward, we have all those records that you can take with you. So I think it's best to probably let us know. And you can upload those records through the student health portal, just like any other document.
Fantastic. Thank you so much. So let's go back to you, Michael. We've got another classroom related question about TAs and other instructional staff who are non-faculty and their availability of masking and so on.
Yeah, no, I should have been clear, Jillian. You know, when I should have just said instructors generally, not faculty, right? If you're instructing a class, and I'm posting the link to our teaching Teach Anywhere instructional sort of resource with Q&As, how you would go get a box of, you know, disposable masks to have handy. It's always a good idea, I think, for the TAs and if the instructor doesn't address it when you have your first TA meeting, you know, talk it through. It might be that the instructor just goes and gets a whole bunch of boxes for everyone, so you're all kind of prepared right at the beginning, so not everybody has to go over and get it. However, that, you know, depends how many TAs and how many students are involved in the class. Lots of ways to organize, but basically the answer is yes, it's for instructors, not just faculty.
Thank you so much. We have a question in the chat, which is a slightly complex one. And so those of you that get my very long emails and maybe spam filter them because I'm very chatty, you will already have seen this before. But for those who aren't, there's a little bit of a flow chart almost, if you will, for people who need some kind of alternative instruction model due to COVID. So the first thing is asking yourself, are you asking this question as a student? So I need support for what I need to receive when I'm receiving instruction, or are you asking as an employee? And so if you're asking as a student, then we have sort of two paths. Do you need alternative instruction because you are trapped in another country or something along those lines? In those cases, we want you in touch with the International Center, and we also want you emailing the UCI teaching questions at UCI email address, and we'll get all of that in the chat. If you are asking us as a student who has a disability concern, we want you going to Disability Services Center, that's DSC. You heard Dr. Hayashida talk about that earlier. Now, this is where it gets really confusing because we like to name everything the same thing. If you are an employee who has a disability concern, and that can be health, or when I say disability, I mean all-encompassing health, disability, et cetera, you're going to go to Disability Management Services. So Disability Services Center for Students, Disability Management Services, if you're contacting us in your role as, say, an ASE or a GSR, or for any postdocs that are on the call. And then the final one is, if you are an employee and you have the international concern, we need you to work with your department chairs as sort of the first line of defense there. And again, really important that you're keeping the International Center apprised of everything that's happening, so they can monitor what's going on with your visas. We will put this in the message that goes out to grad students, postdocs, and grad chairs and so on again this afternoon, because I know it's confusing, but we do have this question about sort of how do we get hybrid options, how do we get remote options depending on these different things. And it is sort of, there are 4 categories of support that you might require depending on why you're asking that question. So maybe this is a question, I'm guessing, perhaps for David from the COVID side, or maybe Dr. Hayashida, if you could speak about religious support in general on campus. We've had a few questions about concerns about religious exemptions and what that actually looks like. I happen to know the religious exemption numbers are incredibly small. So David, maybe you want to remind us of that as well. But if you could talk about how we're ensuring we are protecting religious liberty while staying as safe as we can.
Sure, absolutely. And yes, so the University of California vaccine policy does provide an opportunity for students, staff, and faculty to file for an exception based on a religious objection. Each of those are evaluated individually by a committee that is based here on campus and reviewing those and utilizing guidelines provided from the University of California for the campuses about how we look at those. And I know there was a comment in there about if one person from one faith is approved, shouldn't everybody from that faith be approved? And this really isn't about a particular faith so much as the individual sort of religious convictions of the person that we ask them to articulate in the religious objection form. And we have a very thorough process of reviewing them one by one. We may, if you are applying for one, we may ask you some additional follow-up questions based on your original submittal. And I don't know, Dr. Chang, if there's anything else on that you want to add, but it's a pretty significant process to go through. And you're right, the numbers are limited. We've had so far a fairly small number compared to our 37,000, 38,000 student population.
Yeah, I agree with everything you mentioned, David. It's a long process, but I think it's important that we give attention to each and every one of our students and look at it thoroughly. So please, if you're waiting for your response, please bear with us.
Thank you so much. We actually, believe it or not, have answered, I think, all the questions in the Zoom chat, which means we can pull in questions from the Facebook chat, which we usually run out of time before we can do that. Dr. Chang, I feel like this is probably a solidly you question, but feel free to deflect it to someone else if it's not. There's some questions in the Facebook chat about boosters in general. So can you help us understand, if I had J&J, do I need the booster? If I had Moderna, but I'm not immune compromised, what do I do? Anything on boosters?
Yes, this is a hot topic and hot for me as well, Jillian. So at this point through UCOP, we are approving boosters only for those that qualify through the current CDC criteria, and those including immunocompromised or other specific disease as defined by their providers. So if that's coming up. We do know that there are cases that have shown immunity has been waning for COVID, but it's not clear, as you stated, for the Pfizer, what's the protocol for the J&J, what's the protocol for the Moderna? As that comes up, and I'm checking that daily. So number one, getting to see what that clear criteria is across the board, but then number two, what is our determination as UCOP to support? Now we at our Student Health Center have our COVID vaccines available for support and supply. It's just going to be looking at each individual case. When did you receive your vaccination? When is the required booster, if required, or recommended booster due for you, and getting you scheduled in place? And if we're being a bit overwhelmed because we have, once again, 36,000 students, and that's a lot of booster vaccine to give, we will utilize the CVS across the street, the Walgreens, the public health departments, just as we do for other vaccinations to get that support. So as that information comes, I'm keeping a very close eye on it because it could be a lot of additional shots coming out from our Student Health Center. So yeah, we'll keep you updated.
Thank you so much. That's wonderful. And just as a reminder, you can, of course, go to Student Health for your shots if you're eligible at this time for various things. You can also go to the Albertsons that's walking distance from campus. You can go to CVS. You can go to other places. So whatever is convenient for you, it is free no matter what. You do not have to be a citizen of the US. We strongly recommend you get that taken care of. And we've only got a few minutes left, so I'm just going to remind everyone of some deadlines because it is a busy time and we've thrown a lot of dates at you today. So one that's really important is those folks who need a alternative instruction as students. So remember the UCI teaching questions email address that we provided. The deadline that we are trying to hold to for that is today, to give instructors enough time to figure out how to help you. So please, if you fall into that category of a student with a non-disability or health-related concern who needs an alternative educational accommodation, email Michael's office today, hopefully, at uciteachingquestions.com. The second deadline I want to make sure you are knowing about is the September 6th deadline. That is Monday, Labor Day. That is when we want some evidence of your compliance with the vaccination policy. So please, please get those records uploaded if you haven't done so already. We don't like sending you those naggy mean emails. We'd much rather you just get them uploaded and we can all go on. The third deadline I want to make sure you know is the September 15th deadline that Sonia mentioned regarding your employment. We know that departments are struggling since we switched over to UC Path. It's been over a year, but they're still struggling. Please, please check your Zod accounts, see what's going on. If you do not have your fees paid and you think you should, we want that escalated as quickly as possible. So you can use the resources that Sonia mentioned. You can go through your department. We want to get that. I want that in my office as fast as possible so we can help chase that down, because we do not want you missing your fees or not getting your paychecks or any of those kinds of concerns. And fall is always our toughest time because we're onboarding so many new students and so on. So those are my 3 key deadlines. Do any of our panelists have anything else they want to make sure is on people's radar?
I will just tag on to the September 6th deadline. So you might be thinking, how in the heck can I get compliant if I need 2 shots and there has to be space between the shots? If you get your first dose today, tomorrow, Sunday, Monday, you upload that record, you won't get a notice from us saying you're not in compliance because you're in the process of becoming compliant. And then we will ask you to upload your record as soon as the timing has passed and you're able to get that second dose. So don't hold off. If you've had 1 dose, upload the record. It'll keep you from getting a letter and having to talk to us next week to figure out what to do. So
yes. And I'm just going to read out the phone number that David put into the chat in case you are watching this on the Facebook live stream. You won't see the Zoom chat. Contact tracing services is 949-824-2300. It is also, they are also accessible at contacttracing@uci.edu. They are there, best I can tell, 7 days a week. I get answers really quickly. Maybe they're not there 7 days a week, but it feels that way to me anyway. Please reach out if you need any help related to this. Their team is excellent. They will help you. They will tell you what you can do to support you, again, as a student or as an employee or as both, as many of you are. We are right at 2 minutes until 4 o'clock. So I will again thank our panelists, and oh my gosh, thank you attendees. That was a ton of questions that we got through. Really appreciate all of the thoughtful interest and engagement. We're not at the end by any stretch, but we are moving along towards a really positive, bright future. And I'm so thrilled that all of you are here, both the panelists who are here to support you, but all of the students and staff and faculty who are in the chat right now watching all of this. And thank you, everyone. It's going to be a wonderful fall. We're just going to will it into being, and we're all going to take care of each other. Have a wonderful Labor Day weekend. Please take some time off and rest.